I want to talk a minute about communication and collaboration, because everything you're talking about are very different entities, very different expertise, very different ways of probably approaching a problem. How have you worked through that? And what is that? I mean, what have you learned in this process that might help others?
Something that I hear a lot and something that I do believe we're doing very well is we do have very intentional communication. And it's multi-layered. It's not just one thing. And so there's daily communication. So these teams communicate daily with the case management or the back end work to make sure we're following up with that individual. Also have weekly communication with all the staff together in the same room. And I think that's incredibly valuable because now we can just have those real conversations. I think we've seen sometimes there's conversations had, but they're so high level that nothing can actually occur. Or they're so spaced out that nothing can occur. Well, I think here in Tulsa, these teams, we directly address that. And through that daily communication, that weekly staffing meeting, and then we also have strategic vision where we get together and we just have our conversations with everybody in the leadership about what's going on, how we can improve some of these processes, because this is not simple and this is fairly relatively new co-response. It's not something that there's 50, 70 years of research on these programs, and a lot of this stuff is being developed. And so that intentional communication about how we can improve, Captain Seibert, I mean, you talked a lot about the uniform training for co-response and some of those areas that we can develop. And so I really just think continuing those conversations and making them intentional is really where we've had a lot of good success in Tulsa.
I think a part of our success was building out an operationals manual. A lot of other co-response models don't have that. When we recently went to a conference where we presented, we were asked for our operations manual. It really defines the role of each agency, and we all agreed and came to consensus of what that would look like. So for police, when we say we have a legal issue or we can't take someone into custody or we have a safety issue, we're kind of the authority on that, and they defer to us. When it comes to clinical assessment, we defer to Family and Children's Services. And then for medical, if fire says this person needs to go to the emergency room or they're in a medical emergency or need something, we defer to that.
So leaning into each expertise, which is really a lovely partnership.
But having that agreement and understanding the roles before you're on a call and having a clear understanding of that, I think is what's important. The police department uses something called an operational triangle. So the first foundation of that is safety. And it's not just physical safety, it's legal safety. Are we doing what's legal and right? Psychological safety and physical safety for the team. So we do that first before we start rapport building, and then we can move into that, and then we can move into problem solving. So we layer that approach. And with these 3 disciplines in the car, it's really easy to do that.
So training the team, is there special training that they do besides their own training within their specialty?
I think the training is so important, especially what we've implemented throughout our co-responder models. Just like you were talking about, just understanding each individual's role, because the mental health professional's role may look very different, and we needed to have that understanding of what is legal or what the paramedic will be doing while they're on scene as well. So those training pieces, we got the whole team together and we do training to make sure that we go over all of the roles, responsibilities, and expectations of each of the disciplines to ensure that they're all working together.
Yeah, and I mean, in that operations manual outlines a lot of those things. I mean, it's from small things, to larger things. It could be, hey, we work on these certain holidays, or we're going to be operational when it's snowing outside, or it's the safety items that the Tulsa Police Department provides for us, and we appreciate having. But it outlines those items and really tries to get into some of those gray areas, what I mean, that sometimes these teams have to operate out of. And like I said, they are escalated events sometimes, and so we want to leverage all 3 agencies' knowledge base and wisdom and try to get the best outcome for that individual and keep everybody safe. A big talk a lot for first responders is mental health wellness. and making sure that we're keeping our people mentally healthy for these long careers. And this stuff plays into that. When you're able to put a co-responder on team and you're able to remove, I'll talk about, firefighters on fire trucks from that situation, it eases them, puts them in a better situation because they may not have this level of training that these co-responders do. And I assume it's fairly similar for the law enforcement as well.
Yes. So when we respond to any call, the first thing we're looking at is there a public safety threat? From there, has a crime occurred? So before we ever even get to whether or not someone's in a mental health crisis, we have to check those boxes, right? So it's a little bit different. And we've all seen, even here in Tulsa, tragic stories of police and someone in crisis, the encounters that can happen and the use of force that comes from that, and sometimes a death. So we've seen that. We responded to that. I think what's really interesting about our relationship right now is we're built around a program response, but now we're working together on a system change all the way from 911, when we first get the call, 911 dispatch, and you can go all the way to alternative courts. We have a continuum of care. So the same people in this room right now, the city of Tulsa has bought into this. They hired a chief mental health officer. They're working together to change the whole system. So officers won't be getting those calls that they really shouldn't be going to, the low-level calls. They'll never even see those on the screen. And that, kind of to Justin's point, is that helps with the mental health stuff too. I mean, officers do have a fear of going on a call like this and needing to use force. And with what's come out over the last few years, officers are being charged with crimes related to these things. So they're really hesitant. They're afraid, especially when a crime hasn't occurred and it's just someone in crisis. Yet there may be something that becomes a threat and they have to use force.
Right.